A breast reduction is a way to reduce the size of your breast. A lot of times patients looking for a breast reduction are those that have some type of back pain or rashes underneath their breast, or their breasts just feel way too big for their body, and they want to be able to exercise without discomfort, or they want to look better in their clothing, or have breasts that balance their body. A breast reduction typically takes anywhere from 2.5 to 3.5 hours, and this is solely dependent on the amount of breast parenchyma that I will be removing to get the desire that you're looking for. Breast reduction recovery is really pretty simple. So patients feel so much lighter and so much better, and you can just see that they are way more confident, and they're just lifted, and you can see the glow in their face. The consultation consists of how I'm going to reduce the size of your breast, but more importantly, we'll discuss the size that you are and the size that you want to be, but we'll keep in mind the shoulder width, your waist width, just to give you overall balance. So everyone's a little bit more unique in how much is removed, but the ideal breast is really one that relieves the symptoms. During the operation, I will remove the amount of breast parenchyma that we've discussed preoperatively, and the incisions are just like a breast lift. So not only are you reducing your breast, you're also getting a more perkier full breast. So it's similar incisions, and depending on the amount of breast that we are going to remove, that will determine the type of incision. A big question about breast reduction is scarring. I minimize the scarring by closing in multiple layers and relieving tension from the incisions and placing on special tape. And also the post-operative protocol that I have will decrease the type of scarring. One of the bigger questions I get is, can I breastfeed after a breast reduction? And absolutely, the technique that I use minimizes the risk of not being able to breastfeed, and the majority of my patients have not had any issues. Out of all the procedures that I perform, these are some of the most happy patients and the most satisfied, because it's an instant relief. They don't just see it, but they also feel it.